we call pathological love relationships. It's because we found that a lot of therapists are giving us the feedback that there's not a lot of training about access to in graduate school. In fact, recently I was doing a training in another city that was all varying different levels of therapists in the room. There were some interns that were still in school all the way, social workers, mental health counselors, marriage and family, and psychologists. And when I went around the room and asked, how much training did you get, in-depth training on personality disorders and the effects on other people, or just basic even information on the issue of access to, most of them said that most of the information they got was in less than a week in graduate school. And considering that there are 10 personality disorders and they're not that rare, more and more therapists are saying we need more information about the treatment issues, especially as it pertains to its effect on intimate relationships, and also the effects on the family and parenting when there is someone with an access to. The key to understanding lies in childhood development, which we have been talking about. When development is disrupted, the behavior patterns emerge, and so personality is then used as a strategy to survive early developmental deficits. That's why a lot of these people are very adaptive and conning and smart about getting around people and situations, is because it was used as a strategy early on. But what you're looking for goes back as early childhood or early adolescence. And so whether you get an opportunity to talk with a personality disorder person, or whether you have to elicit that information from her, you're looking for, of course, the issue of early childhood development. Trance states are significantly related to the issue of pathological love relationships. We are finding this to be consistently true, and the women have described it the same way, as if they were hypnotized, as if they were in some kind of trance state, as if they've used those exact kind of words. And we interviewed almost 80 women from different countries. They all describe the same kind of experience. We also have on our shopping cart, as a way of helping these women, a hypnosis tape they can order to reduce symptoms, or we can custom make hypnosis tapes for them, because the best way to get to deal with trance states and the state-dependent learning that happens when you are in a trance state or under hypnosis is to do it the way that it needs to come out, the way that it went in. Read up on state-dependent learning, trance states, and hypnosis. A few words about intrusive thoughts, and you can get more information off the second DVD, but intrusive thoughts are related to past and future obsessing. And they are an anxiety reaction, as you probably know. She replays old memories of him, the relationship, good times, bad times, trauma, things he said or did. And this chronic staying in the past is actually what leads to and increases her depression.